Welcome to Lesson 9, Assistant Surgeon, Co-Surgeon and Team Surgery, part of our Captain Surgery and CPC Exam Preparation Course 2026. In this lesson, we'll learn the key surgical participation modifiers, 80, 81, 82, AS, 62, and 66. We'll focus on the difference between an assistant surgeon, co-surgeons and team surgery, and learn how to select the correct modifier based on who participated and how they participated. Remember, 80 equals assistant, 81 equals minimum assistant, 82 equals resident unavailable, AS equals non-physician assistant, 62 equals company surgeons, 66 equals team surgery. Let's begin. Before we begin Lesson 9, Assistant Surgeon, Co-Surgeon and Team Surgery, let's review what you'll learn in this lesson. First, we'll understand the role of an assistant surgeon and distinguish modifiers 80, 81, and 82. We'll then learn about Modifier AS, which is used for qualifying non-physician practitioners providing assistant at surgery services. Next, we'll cover Modifier 62 for co-surgeons and Modifier 66 for team surgery. A major CPC exam focus is understanding the difference between an assistant surgeon, co-surgeon, and surgical team. Instead of selecting a modifier based only on the number of people involved, we need to understand who participated, how they participated, and what the procedure requires. Our coding approach is WHO participated right pointing arrow. How did they participate? Right pointing arrow. Check the procedure indicator. Right pointing arrow. Verify documentation. Right pointing arrow. Select the modifier. Remember the key modifier sequence. 80 equals assistant surgeon. 81 equals minimum assistant. 82 equals qualified resident not available. AS equals non-physician assistant. 62 equals Colorado surgeons. 66 equals surgical team. This lesson is provided for educational and CPC exam preparation purposes only. It does not replace the official Captain Codebook, CMS guidance, NCCI policies, payer requirements, or professional coding advice. For 2026 Medicare coding, always verify the current procedure-specific indicators and documentation requirements before selecting a modifier. With those objectives in mind, let's begin assistant surgeon, co-surgeon and team surgery. Now let's understand what an assistant surgeon means. An assistant surgeon is a physician or other qualified practitioner who assists the primary surgeon during a surgical procedure. The assistant may help with tasks necessary to safely perform the operation, while the primary surgeon remains responsible for performing the principal surgical service. For CPC exam purposes, remember the main assistant at surgery modifiers. 80 equals assistant surgeon, 81 equals minimum assistant surgeon, 82 equals assistant surgeon when a qualified resident is not available. AS equals non-physician assistant at surgery. However, don't assume that an assistant can be separately reported for every surgical procedure. For Medicare, you must check the procedure-specific assistant at surgery indicator and applicable documentation requirements. Here's an important CPC trap. 2 surgeons participated, so modifier 62 must be used. Not necessarily. If one surgeon is the primary surgeon and the other is assisting, this is an assistant at surgery situation, not automatically co-surgery. Remember, 80, 81, 82 equals assistant surgeon concepts. 62 equals company surgeons. 66 equals team surgery. Your CPC workflow is: identify the participant, right pointing arrow, determine their role, right pointing arrow, check the procedure indicator, right pointing arrow, verify documentation, right pointing arrow, select the appropriate modifier. The key takeaway is, assistant surgeon means assisting the primary surgeon during the surgical procedure. Always verify the current CPT, CMS, NCCI, Medicare indicators, and payer-specific requirements before reporting the service. Now let's focus on Modifier 80, Assistant Surgeon. Modifier 80 is used when a physician assists the primary surgeon during a surgical procedure, when the applicable Medicare or payer requirements for assistant at surgery services are met. The key memory is simple: 80 equals Assistant Surgeon. For Medicare, Modifier 80 is not automatically reportable for every surgical procedure. We must check the procedure-specific assistant at surgery indicator in the Medicare physician fee schedule. The assistant's services must also be supported by the applicable requirements and documentation. Here's a simple example. A primary surgeon performs a procedure, and a second physician assists during the operation. If the procedure and circumstances allow assistant at surgery payment, the assisting physician may report the surgical procedure with Modifier 80. Now remember the important distinctions. 80 equals physician assistant surgeon. As equals non-physician assistant at surgery. 62 equals Colorado surgeons. 66 equals team surgery. Here's the common CPC trap. 2 physicians participated in surgery, so modifier 62 must be used. That's incorrect. If one physician is the primary surgeon and the other is assisting, think modifier 80, not automatically modifier 62. Your CPC workflow is: identify the participant, right pointing arrow, determine their role, right pointing arrow, confirm physician status, right pointing arrow, check the assistant at surgery indicator, right pointing arrow, verify documentation, right pointing arrow, report 80 when appropriate. Remember, primary surgeon plus physician assisting equals modifier 80 when the applicable requirements are satisfied. Always verify the current CPT, CMS, NCCI, Medicare indicators, and payer-specific requirements before reporting modifier 80. Now let's focus on modifier 81, minimum assistant surgeon. Modifier 81 identifies a physician who provides minimum or limited assistance during a surgical procedure, when the applicable procedure and Medicare or payer requirements are satisfied. The key memory is 81 equals minimum assistant surgeon. Think of the situation this way: the primary surgeon performs the procedure, while another physician provides only the minimum level of assistance needed during the operation. For Medicare, modifier 81 does not automatically mean that the assistant service is payable. We must check the procedure-specific assistant at surgery indicator, along with medical necessity and documentation requirements. Remember the distinction: 80 equals assistant surgeon. 81 equals minimum assistant surgeon. 82 equals assistant surgeon when qualified resident is not available. As equals qualifying non-physician assistant at surgery. Here's the common CPC trap. Modifier 81 means the procedure automatically qualifies for assistant surgeon payment. That's incorrect. The modifier does not replace the need to verify the procedure indicator, documentation, medical necessity, and payer requirements. Your CPC workflow is: identify the assistant, right pointing arrow, confirm physician status, right pointing arrow, determine level of assistance, right pointing arrow, check the assistant at surgery indicator, right pointing arrow, verify documentation, right pointing arrow, report 81 when appropriate. Remember, 81 equals minimum assistant surgeon. Always verify the current CPT, CMS, NCCI, and payer-specific requirements before reporting modifier 81. Now let's learn about modifier 82, assistant surgeon when a qualified resident is not available. Modifier 82 indicates that a physician provides assistant at surgery services because a qualified resident surgeon was not available when the applicable Medicare requirements are met. The key memory is 82 equals assistant surgeon plus qualified resident not available. This modifier is especially important in teaching hospital situations. For example, a physician performs a surgical procedure, but the qualified resident who would normally provide surgical assistance is not available. Another physician assists with the operation. When the applicable requirements are satisfied, modifier 82 may be reported for the physician's assistant at surgery service. Now compare the three modifiers: 80 equals assistant surgeon, 81 equals minimum assistant surgeon, 82 equals assistant surgeon when qualified resident is not available. Here's the common CPC trap. Any assistant surgeon working in a teaching hospital should use modifier 82. That's incorrect. The key question is, was a qualified resident surgeon unavailable? Modifier 82 is specifically connected to that circumstance. Your CPC workflow is: identify the assistant, right pointing arrow, confirm physician status, right pointing arrow, check whether a qualified resident was available, right pointing arrow, verify the procedure's assistant at surgery indicator, right pointing arrow, review documentation, right pointing arrow, report 82 when appropriate. Remember, 80 equals assistant, 81 equals minimum assistant, 82 equals qualified resident not available. Always verify the current CPT, CMS, NCCI, Medicare procedure indicators, and payer-specific requirements before reporting modifier 82. Now let's learn about modifier as non-physician assistant at surgery. Modifier as is used for qualifying non-physician practitioners who provide assistant at surgery services. For Medicare, this includes a physician assistant, or PA, nurse practitioner, or NP, and clinical nurse specialist, or CNS, when the applicable requirements are satisfied. The key memory is as equals non-physician assistant at surgery. For example, a surgeon performs an eligible procedure, and a physician assistant actively assists during the operation. When the applicable Medicare requirements are met, the assistant at surgery service is reported using Modifier AS. Now compare the modifiers. 80 equals physician assistant surgeon. 81 equals physician minimum assistant. 82 equals physician assistant when a qualified resident is not available. As equals qualifying non-physician assistant at surgery. Here's the common CPC trap. Modifier 80 should be used because the PA assisted the surgeon. For Medicare reporting, that's incorrect. CMS distinguishes the physician assistant at surgery modifiers 80, 81, and 82 from AS, which identifies qualifying non-physician practitioner assistant at surgery services. Your CPC workflow is: identify the assistant right-pointing arrow, determine whether the practitioner is a PA, NP, ORCNS right-pointing arrow, confirm assistant at surgery eligibility right-pointing arrow, check the procedure-specific indicator right-pointing arrow, verify documentation right-pointing arrow, report as when appropriate. Remember, WHO is assisting? Physician right-pointing arrow 80, 81, OR 82. PA, NP, ORCNS right-pointing arrow as. Always verify the current CPT, CMS, NCCI, procedure-specific indicators, payer requirements, and documentation before reporting Modifier AS. Now let's learn about Modifier 62, two co-surgeons. Modifier 62 is used when two surgeons from different specialties work together as primary surgeons and perform distinct portions of the same surgical procedure, when the procedure and payer requirements allow co-surgery. The key memory is 62 equals two co-surgeons. For Modifier 62, both surgeons function as primary surgeons. Each surgeon performs a distinct portion of the same procedure. Here's an important distinction. Modifier 80 equals assistant surgeon. In an assistant surgeon situation, one surgeon is the primary surgeon and the other surgeon assists. With Modifier 62, both surgeons are functioning as primary surgeons and performing distinct portions of the procedure. Here's the common CPC trap. Two surgeons participated, so Modifier 62 must be used. Not necessarily. Ask these questions. Are both surgeons functioning as primary surgeons? Are they from different specialties? Are they performing distinct portions of the same procedure? Does the procedure permit co-surgeon reporting? If one surgeon is simply assisting the primary surgeon, think 80, 81, or 82, not Modifier 62. For Medicare, also check the procedure-specific co-surgeon indicator in the physician fee schedule. Your CPC workflow is: identify both surgeons' right-pointing arrow, check their specialties right-pointing arrow, determine whether both are primary right-pointing arrow, confirm distinct portions right-pointing arrow, check the co-surgeon indicator right-pointing arrow, verify documentation right-pointing arrow, report 62 when appropriate. Remember, 62 equals two surgeons plus different specialties plus both primary plus distinct portions of one procedure. Always verify the current CPT, CMS, NCCI, payer requirements, procedure-specific indicators, and documentation before reporting Modifier 62. Now let's learn about Modifier 66, team surgery. Modifier 66 is used when a procedure requires a team of surgeons because of the complexity or special circumstances of the procedure, and the applicable requirements for team surgeon reporting are satisfied. The key memory is 66 equals surgical team. Think of a highly complex procedure where multiple surgeons work together as a surgical team, rather than one surgeon simply assisting another. Now compare. 80 equals assistant surgeon. One surgeon is the primary surgeon and another assists. 62 equals Colorado surgeons. Two surgeons, generally from different specialties, function as primary surgeons and perform distinct portions of the same procedure. 66 equals team surgery. A procedure requires a surgical team because of its complexity or special circumstances. Here's the common CPC trap. 3 surgeons participated, so Modifier 66 must be used. That's incorrect. The number of surgeons alone does not determine Modifier 66. Ask: does the procedure require a surgical team? Does the procedure's team surgeons indicator permit team surgery? Is the medical necessity for the team supported by documentation? For Medicare, check the procedure-specific team surgeons indicator before reporting Modifier 66. Your CPC workflow is: identify the procedure right-pointing arrow, determine whether a surgical team is required right-pointing arrow, identify the participating surgeons right-pointing arrow, check the team surgeon indicator right-pointing arrow, verify medical necessity and documentation right-pointing arrow, report 66 when appropriate. Remember, 80 equals assistant. 62 equals Colorado surgeons. 66 equals team surgery. The key takeaway is, Modifier 66 is about the need for a qualifying surgical team, not simply the number of surgeons involved. Always verify the current CPT, CMS, NCCI, procedure-specific indicators, payer requirements, and documentation before reporting Modifier 66. Now let's bring all 6 modifiers together and make the distinctions clear. First, Modifier 80 means assistant surgeon. A physician assists the primary surgeon during the procedure. Modifier 81 means minimum assistant surgeon. The physician provides the minimum level of assistance. Modifier 82 means assistant surgeon when a qualified resident is not available. Modifier AS identifies a qualifying non-physician practitioner assistant at surgery, such as a PA, NP, or CNS, under applicable Medicare requirements. Now we move to co-surgery and team surgery. Modifier 62 means 2 co-surgeons. The surgeons function as primary surgeons and perform distinct portions of a qualifying procedure. Modifier 66 means team surgery, where the procedure requires a qualifying surgical team because of its complexity or special circumstances. Here's an important CPC exam trap. More than one surgeon participated, so use modifier 62 or 66. That's not automatically correct. The first question should always be, who participated? Then, what role did each person perform? Was it an assistant, co-surgeon, or surgical team? After that, check the procedure-specific indicator, verify the documentation, and select the appropriate modifier. Here's your quick memory. 80 equals assistant. 81 equals minimum assistant. 82 equals resident not available. As equals PA, NP, ORCNS. 62 equals Colorado surgeons. 66 equals team surgery. One important Medicare point. Modifier AS identifies qualifying non-physician assistant at surgery services, and CMS requires us to be reported with the applicable assistant modifier when required. For CPC preparation, don't simply memorize the numbers. Understand who participated and how they participated. Your final workflow is, WHO participated right pointing arrow. How did they participate? Right pointing arrow. Check the indicator. Right pointing arrow. Verify documentation. Right pointing arrow. Report correctly. Always verify the current CPT, CMS, NCCI, procedure-specific indicators, payer requirements, and documentation before reporting these modifiers. Now let's apply everything we've learned with a CPC scenario involving assistant surgeons, co-surgeons, and team surgery. A complex surgical procedure is performed by 2 surgeons from different specialties. Both surgeons actively perform distinct portions of the same procedure, and both function as primary surgeons. Which modifier best represents this surgical relationship? The answer is modifier 62, 2 co-surgeons. When the procedure permits co-surgeon reporting and the applicable documentation and payer requirements are satisfied, modifier 62 may be appropriate. Now let's change the scenario. If one surgeon performs the primary procedure and another physician simply assists, think modifier 80, assistant surgeon. If the physician provides minimum assistance, think modifier 81. If a physician assists because a qualified resident is not available, when the applicable requirements are met, think modifier 82. If a qualifying PA, NP, or CNS provides assistant at surgery services, think modifier AS, together with the applicable assistant modifier when required. And if the procedure requires a surgical team because of its complexity or special circumstances, think modifier 66, team surgery. Now here's the common CPC trap. 2 or more surgeons participated, so modifier 62 must be used. That's not automatically correct. The number of surgeons alone does not determine the modifier. Instead, ask 6 important questions. Who participated? What role did each person perform? Are they assisting or functioning as primary surgeons? Are they performing distinct portions of the procedure? Does the procedure permit the modifier? And finally, is the documentation sufficient? Your CPC decision path is surgical participation. Right pointing arrow. Identify the assistant OR surgeons. Right pointing arrow. Determine their roles. Right pointing arrow. Check the procedure specific indicator. Right pointing arrow. Verify documentation. Right pointing arrow. Select the appropriate modifier. Remember your exam memory. 80 equals assistant. 81 equals minimum assistant. 82 equals resident not available. As equals PA, NP, ORCNS. 62 equals Colorado surgeons. 66 equals team. And here's your final CPC tip. Don't count the surgeons. Understand their roles. Remember, WHO plus role plus procedure plus documentation equals correct modifier. Always verify the current CPT, CMS, NCCI, procedure-specific indicators, payer requirements, and documentation before reporting these modifiers. This is Captain Surgery, CPC Exam, Medical Coding Course 2026, from KS Medical Coding Academy. Let's summarize Lesson 9, Assistant Surgeon, Co-Surgeon and Team Surgery. We covered 6 important surgical participation modifiers. Modifier 80 means assistant surgeon, a physician assists the primary surgeon. Modifier 81 means minimum assistant surgeon. Modifier 82 means a physician provides assistant at surgery services when a qualified resident is not available, when the applicable requirements are satisfied. Modifier AS identifies qualifying non-physician practitioner assistant at surgery services, such as those provided by a PA, NP, or CNS, under applicable Medicare requirements. Modifier 62 means 2 co-surgeons. The surgeons function as primary surgeons and perform distinct portions of a qualifying procedure. And Modifier 66 means team surgery, when a qualifying procedure requires a surgical team because of its complexity or special circumstances. Now remember the most important distinctions. 80 equals assistant, 81 equals minimum assistant, 82 equals resident not available, AS equals PA, NP, OR CNS. 62 equals Colorado surgeons. 66 equals team surgery. Here are the major CPC traps. 2 surgeons do not automatically mean modifier 62. Several surgeons do not automatically mean modifier 66. And a physician assistant does not automatically mean modifier 80. Instead, use the correct CPC approach. WHO participated? What role did each person perform? Was it an assistant, Colorado surgeon, OR team? Then check the procedure-specific indicator, verify the documentation, and select the appropriate modifier. For 2026 Medicare coding, always verify the current CPT, CMS, NCCI, procedure-specific indicators, payer requirements, and documentation. And remember your final CPC rule: don't count the surgeons, understand their roles. WHO plus role plus procedure plus documentation equals correct modifier. Excellent work. Lesson 9, Assistant Surgeon, Co-Surgeon and Team Surgery, is complete.